stay here in this place. So even also now we have got this, you know, for them. So this one.
All right. Good morning, good afternoon, good evening, everyone, wherever you may be. I would like to say welcome and thank you to our speakers and guests for joining us today. Valued HPN Tigray members, valued HPN4Tigray members, the Tigrayan community at large, partners, donors, and allies, I would like to say thank you for your hard work, commitment, and efforts to help those suffering in Tigray. It's because of you that HPN is here today. You have been instrumental in helping us transform this organization from an idea born out of despair into a grassroots movement with over 200 members from all walks of life. As you've seen in the video, albeit the lack of access and blockade, HPN has been able to lead initiatives to prevent severe acute malnutrition, help in provision of clean water, to prevent waterborne illnesses, as well as to build a wellness center and education center for those displaced. It is with a heavy heart that I share this stage with you all to mark HPN4Tigray 1-year anniversary, as the total blockade to Tigray continues to claim lives on a daily basis. For the people of Tigray, it has been over 430 days of agony. Innocent women and children are dying needlessly. Health providers across Tigray are warning us. They're warning us about the death tolls. Children dying on hospital beds because of lack of life-saving medicines. They are still hopeful the world would hear them. As global citizens and health professionals, we stand for humanity. We stand in solidarity with those suffering and with those who are forced to offer nothing more than signing a death certificate. We've prepared this panel discussion to raise awareness, to draw parallels, and to learn from other regions in the world that have gone through similar experiences, and garner allyship to advocate for humanitarian access and end this humanitarian catastrophe. I just wanted to pass along something that we want to keep for our audiences. If you have any questions or comments throughout the panel discussion, please continue to engage via the Q&A feature in the Zoom, and we will be following up with these questions. We thank you again, and please get involved in our humanitarian endeavors, from advocacy to resource mobilization to meet the unmet needs on ground. Visit our website and follow us on social media to learn more about our advocacy and fundraising efforts. With that, I would like to introduce our experts. And please note that we are joined by giants today, and introductions are shortened in the interest of time. I'm gonna go ahead and start with Dr. Kapila. Dr. Kapila has over 30 years of experience in international affairs, sustainable development, humanitarian provision, global health, social service delivery, peace and security promotion, and humanitarian rights advancement, including the prevention of genocide and crimes against humanity. Dr. Kapila obtained his medical degree from the University of Oxford and received his postgraduate degree in public health from the London School of Hygiene and Tropical Medicine. Dr. Kapila has dedicated his life to serve the international community in many capacities, from founding and heading government agencies that dealt with conflict and humanitarian affairs worldwide, to serving as a special advisor and envoy representative to many UN agencies, the WHO, as well as Red Cross, Red Crescent societies in many war-torn countries. Currently, Dr. Kapila is Professor Emeritus of Global Health and Humanitarian Affairs at the University of Manchester. He is a respected intellectual and a renowned author, and has received several prestigious awards for his public service. The international community is forever indebted to his lifelessness, to his selfless efforts. Gonna go ahead and introduce Professor Tony. Professor Tony graduated from Harvard Medical School with concentration in neuroscience and went on to train neurosurgery at the University of Miami. He came to develop neurosurgery and neuroscience at Magana University College of Health Sciences Medical School in Tigray in 2015, after 3 years spending in Addis Ababa at Bethel Hospital in Wallo University. At Ayder Hospital, he subsequently began teaching medical students, as well as starting a neurosurgery residency program and neurobiology PhD program in cooperation with the Institute of Biological Sciences. He was the co-chair of the multidisciplinary research team, which studied the occurrence of neural tube defects and its associated causative factors, resulting in publication in major impact journals. He advised the Tigray government and health authorities to improve the healthcare system in Ethiopia. Serving on the Research Reform Committee of the Magana University, he was involved in improving the research mechanisms and establishment at the university. He traveled extensively in Tigray, visiting research sites and meeting local healthcare providers to discuss prevention and treatment of neural tube defects. He was living and working in Magana when the conflict with Ethiopia began in November 2020 and remained there until December of 2020. He was a witness to the assault on Magana and involved in medical care of both combatants and innocent brought to Ayder Hospital at that time. Last but not least, I have Dr. Hayelom. Dr. Hayelom completed his PhD studies in embryology and teratology at Maastricht University in the Netherlands. He returned to Tigray, where he served initially as an assistant professor at Ayder University Hospital, and later as the head of public and international relations of the university, where he worked with over 50 international partners in resource mobilization, both material and manpower, and delivery of services at Ayder, propelling Ayder University Hospital to become one of the best university hospitals in the country. When the war on Tigray broke out, he became the interim chief executive director of Ayder University Hospital. In his role, he oversaw both the college and hospital activities during the difficult time. During his time as executive director of Ayder, he tirelessly tried to expose the atrocities committed against civilians and the destruction of healthcare system to dignitaries like EU envoy, the president of Ethiopia, as well as the Ministry of Health Ethiopia. Currently, Dr. Hayelom is attending postdoctoral training in neuroanatomy at the University of Maryland, and he continues to share his experience and bear witness of what took place in Tigray in many different platforms. He has authored multiple peer-reviewed publications, including the Joint Human Rights Watch report on the rampant SGBV in Tigray during this war. Please help me welcome our speakers to the stage. We are grateful for their willingness to share their expertise and wisdom during this critical time, where millions are facing unprecedented humanitarian disaster in Tigray and many other regions. Next, I would like to welcome our moderators who have been tirelessly working to put this panel discussion together to the stage. I have Dr. Tigray, who also uses the name Dr. Waini in short. Dr. Waini obtained her medical degree from Gondar College Medical Sciences, and served as a physician in Ethiopia, where she also designed and implemented prevention programs for infectious diseases. Her initiative earned her merit-based scholarship to pursue graduate study at the University of Bergen, Norway, where she received a PhD in international health. She later completed a postdoctoral fellowship at the College of Health Sciences at Old Dominion University, Norfolk, Virginia. Dr. Waini is a public health researcher with multiple peer-reviewed publications. She's an avid advocate for humanitarian access to Tigray, a proud member of HPN4Tigray, and the leader of the research and health policy team of our organization. I have Ayder. Ayder obtained his dual degree in biology and public health from the University of Massachusetts Amherst. He worked as a clinical research coordinator at the Stanford Center Institute, and he is currently a fourth-year MD candidate at Harvard Medical School, pursuing a specialty in emergency medicine. At HPN4Tigray, Ayder serves as a board member and co-leader of the health policy and research team. His scholarly interests include global health systems and policy research in fragile and conflict-affected settings and emergency health systems implementation, and capacity building in low and middle-income countries. I am going to hand it over to Dr. Waini. She's gonna give us a bit of a background for our discussion today. Thank you for your attention.
Thank you. Just to give a short background on the Tigray health system. 3 decades in the making, the Tigray health system was one of the best in the Horn of Africa. The 3-tier health system had 741 health posts in villages, 242 health centers in towns, 47 hospitals, and an ambulance-equipped referral system. There were typically 13 million hospital visits every year. Among them, about 24,000 for diabetes, 20,000 for hypertension, 44,000 for HIV, 1,500 for tuberculosis. Before the war broke out in November 2020, all these patients were receiving care. What's more, Tigray had made great progress in its health system over the past decade. In 2011, only 1/3 of women had access to skilled delivery. Starting from 2012, at least one antenatal care visit was mandated for every pregnant woman in Tigray. By 2019, 80% of Tigrayan women had access to skilled delivery. That same year, more than 83% of children were vaccinated against the measles. Over 73% were fully vaccinated. Maternal mortality rate dropped from 1,000 to 186 in the past 20 years, while child mortality rate went down from 167 to 30. Tigray also implemented an effective control system for COVID-19. Across the region, there were 4,000 beds in 6 different isolation and treatment sites, as well as 6 COVID testing labs. But again, this high-functioning health system has seen unspeakable destruction in the ongoing war on Tigray. There are a wealth of reports showing that the health system was not merely impacted by the war, but rather targeted deliberately by the invading forces. Approximately 80% of health facilities were deliberately destroyed and looted. And before the war, about 82% of essential drugs were available at Ayder Hospital. Ayder is Tigray's largest 500-bed referral hospital. Now, due to a blockade imposed on Tigray, Ayder has not received a supply of neither medicine nor equipment for over 7 months. This past year, in 2021, the hospital had only 17% of essential drugs and has almost none as we speak. Ayder is running out of everything: insulin, antibiotics, cancer drugs, oxygen, nutritional supply for malnourished children, reagents for basic labs, you name it. Its doctors say Their patients are dying because of infections, amputations, organ failures, and other complications linked to the shortage of essential medicines and equipment. Just last week, on the 5th of January, there was a report by Reuters that a child wounded in an airstrike bled to death after doctors ran out of gauze and IV fluids. Another baby died because there were no fluids for dialysis. These are just a few of countless examples. In the words of a provider at Ayder Hospital, signing these certificates has become our primary job. So my question is, Dr. Hayelom, to you. Dr. Hayelom, you contributed to the making of Ayder Referral Hospital. As an educator, you worked as a researcher, as an administrator, and you also witnessed firsthand the devastating impact of the war on Tigray's healthcare. Can you give us a sense of the magnitude of the impact that the closing of Ayder Hospital will have on the people of Tigray and neighboring populations? Dr. Hayelom.
Thank you very much, Dr. Tigray, and also thank you very much, Dr. Risham, for the introduction, a very nice introduction, of course, and also for HPN4Tigray for giving me an opportunity to share about Ayder, and in particular, in general, about the health system of Tigray. As to give a little bit background about Ayder, Ayder was established in 2003 by a very few very hardworking GPs, around 10, and only one senior physician. And only one senior physician. Along the course, it becomes very much increased both in infrastructure and also in human capital. So I want to just mention that along the course, as I mentioned, it was only few general practitioners and only one specialist. But at the moment, before the war, Ayder has reached around 135 specialists and also 35 subspecialists. So you can see how the number of manpower has increased within the last 15 and 16 years. And in infrastructure, if you look at that, Ayder is providing around 16 services for not only Tigray, but also it includes the whole Afar and northern Wollo and northern Gondar. So the catchment area of the Ayder University Hospital is around 8 up to 10 million population, including the refugee peoples who came from Eritrea, who have been also located in Tigray. So it's around the 10 million population. So it is one of the modest university hospital in the northern part of the country. And to mention some of the most important services, along with the routine one, is we have a forensic services, which has been given only in Addis, and we have also pathological services and some of the most important services in cardiology and some others. So we can only find few of these services only in Addis or sometimes in Hungary. And also when we look to the infrastructure, as Dr. Tigray mentioned, has more than 500 beds, as I mentioned, and more than 3,000 employees, which includes that I mentioned the number of 135 specialist physicians and also 35 subspecialist physicians, including 1,000 nurses and other health professionals, and also around 1,000 academic staffs, and around 1,000 academic staffs, and also around 1,000 support staffs of Ayder. So it's around 3,000. And the other thing is, Ayder has been very important in research conducting and community services for the whole Tigray and Afar. We had a very good projects with Afar and Samara universities and the northern sector universities, which include Samara, Wolia, and other universities of Tigray. So based on its performance of community service and also research, it has been stand third in the country and fourth is in the whole African regions in 2018. And based on of this, we have been awarded a certificate of recognition from the Ministry of Health and also from the country. And this, and also provided based on this, we have an Ayder has a very important international partners across the globe. And we used to have around more than 50 international partners. And these international partners are providing not only infrastructure and materials, but also important in providing of developing of all staffs and their skill and also trainings. And based on this, Ayder in the last 5 years has started a new subspecialty programs along with some of the universities in the United States, like Urogynecology Fellowship and the pain and palliative care programs from the Texas University too. So these are one of very important initiatives where Ayder has been conducting during peacetime. And then Ayder has also continued to grow, both academically and in a service-wise, that in academic programs, Ayder has started to develop 13 residency programs, which is also very important in the northern part of the country, and also 2 PhD programs in publication and a basic science program. So Ayder has been a very important contributor, both in human and power, and also in service provisions to the whole regions, plus to some other regions of the country. So based on this, it has been awarded many, and many of its students have been also integrated in the health systems of the Minister of Health program. So Ayder has been a very indispensable part. But this all, what I'm telling you, is before November 2022. But then afterwards, Ayder has been changed. So now I can split in a very few during the blockade. And after took on November 2020 and up to June, Ayder has started little bit function in 10 services. So it diminished 16 services to 10 services in a very scanty manner, that it's also getting of medicine and some reagents has been reduced to 40 and 50%. The blockade, it was completely blocked. All these services that I have been mentioning has been completely blocked, and the staffs has been in disarray, I can say, because they have been there, but they didn't even get their salary for the last 7 and 8 months, and they have been also very difficult in sustaining of their family too. So the human catastrophe, what's happening at the moment, as doctors are going to mention, is really, really touching. So I had even a call this morning in Ayder of my colleagues back home, and it's really pressing. So people are dying every day. Those who have been in a very chronic disease, patients have been dying in every day, and those who have been sustained trauma of air strikes and drone strikes have never been getting any medication, so are just dying. So Ayder, you can imagine, from 90 to 80% of its services at the moment, it has only 1 or 2 services, which may be also closed in the coming 2 or 3 days or weeks. And the people who have been very good in the providing of service has been also in their own difficulty sustaining of their family. So in short, you can imagine from 90 to 80%, and then it reached to none in the last few weeks and months. So this is just as a background in Ayder. Thank you, Dr. Zagoi.
Thank you, Dr. Hayelom, for highlighting how important Ayder is, not only for the people of Tigray, but also to many other patients coming from neighboring regions. You mentioned Wallo, you mentioned Gondar, you mentioned Afar, you mentioned Eritrean refugees. It is devastating that such a hospital with such capacity, instead of being protected by the federal government and maintained by the federal government at a time when the people of Tigray need it most, now it has been targeted at the same, not supplied with the necessary equipments. And the physicians feel disabled, that they couldn't provide the much needed help and care for their patients. Thank you for giving us that highlight. But I have a follow-up question, Dr. Hayelom. There are about over 2 million IDPs, internally displaced people, that face unique vulnerabilities. As you know, crowding and living conditions will increase the risk of transmission of communicable diseases and outbreaks, including COVID-19. How have health services been provided to these IDPs, if any? Were there health services for these 2 million people? How? Thank you.
Thank you very much. Yes. So initially, when we start in January, at least in December, as I mentioned, in November and December was very difficult, even for Ayder, both because there have been attempts of looting and there have been attempts of destruction of Ayder by itself. And for that, many people has sacrificed to maintain Ayder what it was, at least in a premises wise. And starting from January, and the IDPs has come to Ayder, and then on that time, it was very difficult because it wasn't, we were not prepared. And then most IDP had been located in schools and with no any sort of health awareness, health provision at that time. And then along the course in February and March, there start to be we just send our physicians and nurses at least to screen those who have problems so that they can come to Ayder and get treatment in early time. And like HPN4Tigray has also contributed to appoint people on the ground to help with health professionals, to help those IDPs, both in malnutrition and also in health awareness, and also to facilitate a referral system to Ayder. And this was happened in a small amount because the IDPs, as you mentioned, are really quite in number. There have been 2 million, and most of them are in Mekelle and Shire. It's very difficult to sustain them. But during even that time, COVID is just, I can say, it's just a privilege. So nobody is, because we have much more devastating of war and injury and airstrike. So people are not conscious or are not just consider COVID test and also because there was no any COVID test, has been there before the war, but it was totally distracted. And then people have no access to mask and to vaccination or vaccines of COVID and also any other things. So they are in a very congested, in one room, more than 100 households have been there in a school room. So there is no hygiene and there was no water. And so we try to intervene with the interim government that people need those stuff, but it was really a very difficult part. So there is no access to the health to the extent they need, and even in a very minimal way. And there is no also COVID prevention mechanism, and also finding of this mask is also very difficult. So this was before a complete blockage. So you can imagine now was they have many problems. And even they cannot sleep. If you follow last 2 days, even those who have been in makeshifts in the school has been also bombed by drone and airstrike. So along with their starvation, along with their problems of health, and they couldn't even sleep from where they came. So they came from the Western Tigray, and all their materials and their wells has been destroyed and looted by the intruders. But now they cannot even stay in safe where they came from. So it's really a multifaceted problem that the IDPs are facing. And some of them have also a full-blown psychiatric problems. So they have a mental disturbance because these people have in their account much more money, but they couldn't withdraw because their account was blocked in a bank. They cannot withdraw. So they cannot sustain their family. So they are seeing by their naked eyes, their kids are dying because of lack of medicine and food. And now they are also dying by the airstrike and the drone strike. So it's what we are facing is a very systematic way of subjugating the society to its knee. So this IDPs, I can say that there is no, after the blockage was imposed by the government, there is no any sort of provision of medicine, and also they are really in a very rampant malnutrition of the kids, and they have also a full-blown psychiatric problem. Many partners, they want to try to give their service and all the materials provisions, but there is no way that this all material will get in to the area. Thank you, Dr. Tigray.
Thank you, Dr. Hayelom, for walking us through to lives of IDPs that have lost everything because of the war imposed on them, probably genocide, no form of service, no form of health care provided to them, no food, living under crowding conditions at a time when the world is struggling with COVID-19, let alone to get what the rest of the world population is getting vaccine or social distancing or masking privileges. This IDP, this internally displaced people from Tigray are crowded in small places with no health care. Thank you for just sharing your firsthand experience into this humanitarian catastrophe, what is happening in Tigray right now. Thank you, Dr. Hayelom.
Thank you, Dr. Hayelom and Dr. Waini. My next question is to Professor Tony. Professor Tony, you were a healthcare provider and a faculty member in Tigray when the war broke out. You have witnessed the targeted destruction and looting of health facilities and the interruption of virtually all educational activities in Tigray, including the training of health professionals, all signs of the impending collapse of the health system that we see now. My first question is regarding the population health impact of this war. Could you share some insights on how to estimate and project the population level mortality that can be directly and indirectly attributed to this war? In your discussion, could you share why it's important for us to quantify this figure and some of the challenges in being able to do so accurately?
Well, there's a concept called the crude death rate, which looks at how many people within a population die per thousand. It was studied in Ethiopia in the 1950s, and it was seen to be 32 per thousand. It was studied again a few years ago, and it had been reduced to 6 per thousand. Now, Tigray was a little bit better off because Tigray received its funding from the federal government based upon population. It didn't get anything extra, but the local government also contributed, and there were foundations that contributed. And so if we look at what just the death rate would be from not having any health care, it would come out to about 228,000 per year for a population of over 7 million. So it goes up fivefold. That does not take into account mortality from civilian casualties from war. It does not take into account famine. So it's going to be increased. And we can estimate that probably tens of thousands of people have been killed in the war. When we first started getting casualties within the first 24, 48 hours at Ayder, I mean, we were seeing hundreds per day. And you have to remember that the transportation was an immediate problem. So we were only seeing the people that could be transported. And we were only seeing the people that to whoever brought them, they looked alive or salvageable. So there were thousands. In late November, when Mekelle underwent a barrage that lasted 24 hours, which Dr. Hayelom and I witnessed. I mean, the house right beside me, everyone was killed. We were seeing more than 130 victims every hour for 24 hours. I mean, it was beyond what we were able to deal with. And there's been, as Dr. Hayelom said, there was a complete shutdown. I stayed until we just couldn't really function anymore. We couldn't get fuel for the generators. You couldn't do x-rays. You couldn't run a lab. You run out of medication. There's not much you can do. You run out of bandages. And not only that, you have to understand that the invading forces, both the federal forces and Eritrean forces, and we knew that there were Eritreans there right away because they didn't speak Amharic. And anybody that's a Tigray recognizes the Eritrean accent. They were in every room telling the doctors, right, that the TPLF created this civilian casualty. It wasn't us, which of course everybody refused. So immediately there was this refusal to treat civilian victims. They wanted us to say that everybody that was attacked, that everybody that was brought to the hospital was a casualty from the TPLF, which it was not. So, and I think the other thing I want to say, just to add a little bit to what Dr. Hayelom said, Mekelle University was training specialists and graduate students, not just from Tigray, from all over Ethiopia, from Sudan, from Somalia, from Somaliland, even from Kenya. We were training pediatricians from Kenya. So we were not just a Tigray facility. In fact, you know, probably 1/3 of the specialists in Ethiopia were trained at Ayder. So it was a loss to Ethiopia, not just to Tigray. So you had this devastating loss of healthcare. Like Dr. Hayelom mentioned, we were the specialists for Afar. We were the specialists for Northern Amhara. Even we were more sophisticated than Gondar and Bahir Dar. So many times patient came to see us. Even in some things, we took care of patients from Addis and even Gambella. I did brain tumors from Gambella. We were building a 300-bed cancer center, and our radiation therapy program was being put into place, which has already been paid for. But what happened to that equipment, we don't know. We worked very closely with the Tigray Regional Health Bureau. They had built a 200-bed trauma center, which we were going to be involved in, which most of it was destroyed because there was a lot of destruction in Quiha around the airport. So that's the situation. And finally, Dr. Hayelom was also the head of research for the College of Health Sciences. He's an esteemed researcher. He and I worked together on neurotubular defects. In fact, in the midst of all this, he just published a paper a short time ago. And people recognized us as one of the leaders in neurotube defects from the WHO. They actually came to visit us. So the damage done is not just to the people of Tigray. It's damage to Africa. It's damage to science.
Thank you, Professor Tony. I think it's important to underscore that Ayder and Magana University was an institution beyond the Tigray region. So when we talk about population level impact, we're also talking about a population of Tigray, but also neighboring regions, Ethiopia and other neighboring countries as well. And the figure of more than 200,000 losses just because of the lack of medicine is extremely sobering. Of course, this is probably an underestimation given the many other contributing factors such as malnutrition, as you mentioned. So it's important at least to be able to quantify, measure these figures, as it will have impact on how we think about the future as well. So thank you for that response. My follow-up question for you is specifically regarding health and humanitarian workers in Tigray. We know that health and humanitarian workers, like all Tigrayans, are victims of the collective suffering. But we also know that health workers and humanitarian workers have been targeted and killed as well. Those that remain face the overwhelming responsibility to respond to the explosion of health needs under extremely dire working circumstances, where there's a lack of shortage of basic supplies and medications to treat easily preventable diseases, while also having not received any salary or compensation for more than 7 months, and perhaps even more than that. In your personal account, could you share the impact of this war on the physical and the mental well-being of health workers in Tigray, and the added burden that they are enduring in addition to their day-to-day activities?
Well, they have families, you know, and of course, many of the staff and the residents, the trainees at the hospital and the medical students had families in Tigray. And in the middle of the war, they lost, they couldn't talk to them. They still can't talk to them. Some of them were, that they stayed at the hospital not knowing what happened to their family. These people are not paid high salaries anyway, so they're often living in rented places. They rely upon the food supply from the hospital to eat, and just getting food and transportation became an issue, because even though there was a very good, in the aftermath of the war, there was very good cooperation in the community, people shared a lot, supplies were not coming in. The students at the university, the community helped them. Students from other countries and other regions in Ethiopia, the community made sure they were fed. The doctors went to private clinics to get supplies to help Ayder. One of the problems, you know, most in Tigray are Orthodox. They won't eat wild animals. I tried to set up a program to capture pigeons, because as a kid in Mexico, we learned to catch pigeons on the rooftops. They won't eat pigeons because it's a wild animal. And it was also during the fasting time. So people were making little gardens. Doctors had to become involved in that just to stay alive. You know, it's also a cold part of the year. People had to collect firewood. There was no water. So you had these people going to the river and bringing dirty water. So you had to learn to filter the water with blankets. So taking care of the patients. And one thing that relates to this, that I want to say something about the Tigray mothers. We were getting Eritrean, Oromian fighters and Amhara fighters in the hospital. We didn't have food for them. We didn't have blankets for them. The Tigray mothers came to Ayder and gave them food and gave them blankets. And you know what they said? They said, I hope your mother gets to see you again. I don't know what's happening to my son, but I hope you can go back to your mother. That's the type of people that the Tigray are. You know, they fed the prisoners. They didn't just care about their own. And I think the problem is now ongoing. Many medical students and residents were sent to other places outside of Tigray. And I can't say too much because these people are still at risk. But many of them are now in detention. Those that are not are scared. So even after leaving the region, their place in other places, especially in Addis, is at risk. You know, is at great risk. And I can't say anything more about that because they are at risk.
Thank you, Professor Tony. It is sometimes, it's difficult to connect that. These doctors are not superheroes; they are humans. They starve. They have their own personal worries and concerns. So sometimes it's important to consider what they need and take care of our health workers as well. And thank you for sharing that narrative about the mothers of Tigray and what they've done as well. So that I think is a reflection of our health workers as well. Thank you.
Thank you, Professor Tony. Yeah, that made me partly emotional because I was also raised in Tigray, in a small town, Dugdugo, close to Adwa. All my experience reminded me how we were trained to love our enemies, to support the people that were passing, even to go to church, the old people, monks and nuns that were traveling throughout the year. I will move on with my question to ask Dr. Kapila. Dr. Kapila, in a report you co-authored entitled Healthcare in Conflict Settings, Leaving No One Behind, you write, for civilians caught up in conflict, left behind from global prosperity and progress, the rhetoric around the rule of law, human rights and humanitarian may well seem meaningless. End quote. I think this very much captures what is taking place in Tigray and our real fear that Tigray may have been left behind. But my question is, throughout the war in Tigray, what are some of the things that have stood out to you in contrast to other previous civil wars? You may comment in terms of intent, maybe in terms of nature of combat, maybe in terms of scale of atrocities. What are the differences that stood out, unique for Tigray?
Thank you, and thank you for inviting me to take part in this discussion. I've seen, unfortunately, in my life, I've seen many, many bitter conflicts around the world, in all continents. And the thing that strikes me about the current conflict in Tigray and wider Ethiopia is that within the same conflict, we have all the features, all the bad features that I have not seen in one place altogether. So, for example, I've seen many problems of humanitarian access in many other places. I have seen the targeting of public infrastructure like schools and hospitals. I have seen terrible brutalities. But the thing that strikes me about Tigray is all of them come together in the same space and time, and without any let up, and with the intensity and a continuation of the brutalities that I have not seen elsewhere. I mean, people tell me, I was not involved in it, I wasn't old enough, that the Biafran war was terrible. And I did see for myself that the Sri Lankan war was terrible. But this one, I think, beats it all. It is, in my direct experience and indirect reckoning, the most brutal war on the planet that we have had for several decades. It is definitely a genocide by all the definitions and all the experiences of other genocides that I have been a part of in terms of witnessing. And in terms of the healthcare aspects of it, I've not come across such intensive, extensive, and deliberate targeting of the health infrastructure and the special brutality levied against the health mission. I haven't seen that elsewhere in the same way. Also, in other terrible situations that I witnessed, usually there is a little safety valve. Usually there may be terrible things happening, but somewhere in some corner, in some way, there is a little relief. Somebody is able to find, some bit of humanity has survived. Somebody has found a courageous path through the carnage. So while I marvel at the resilience, at the courage, at the resourcefulness of Tigrayan health professionals that are working there, I'm just lost in amazement as to how can anyone survive under such circumstances. I've not come across that before. So I don't know what more to say other than this is the worst and most brutal conflict that I've ever come across. And it is a shame that in the 21st century, in this corner of Africa, we should have the worst of all humanity, inhumanity, being visited upon the people there.
Thank you, Dr. Kapila. Well, for sharing your expertise about the nature of the previous genocides, previous wars that, against humanity, and how unique we have heard you, watched you, advocate, voice about this Tigray genocide, and for you to come, we've been following how this a combination of evil tools, direct massacre, rape, destruction of farms and burning of everything, and then destruction of the health system, something that you're giving us how much it really is unique, the brutality. And we really appreciate this kind of guidance and understanding. I have a follow-up question. Just to move forward, if the systemic blockage is lifted and Tigray gets unhindered access to humanitarian aid, what critical and health and humanitarian needs demand immediate priority and intervention? This is like, suppose we get the access to Tigray, and how, in order to save as many as lives possible during that emergency response following cessation of hostilities.
Well, before I answer that, let me say that the impact of the health impacts, and of course you can't separate the health impact from the wider impact, lasts and is going to last for much longer than the cessation of the conflict. So imagine that if the war somehow stopped tomorrow and full access was available, unfortunately, many, many more people are still going to die, because even if no one is bombing them tomorrow, and even if they have all the help that they need, the built-in momentum of mortality and the ill-being of people who are barely alive now is such that many of them will drift into death, even if they were given all the assistance they need tomorrow. That's a tragedy. One of my greatest, saddest memories was, for example, seeing in Srebrenica, which also witnessed a genocide in the former Yugoslavia, that when it was lifted, the mortality actually got worse before it got better, because there's so much pent-up disease and malnutrition that was there. So be prepared for that. What that means is that for those who are going to have the great privilege of bringing help and let us hope that is sooner rather than later, there will have to be hugely thoughtful and evidence-based in terms of prioritizing who to save. Because directing resources to those who are savable, salvageable, with immediate assistance has to be, I'm sorry to say this, it may sound a little bit ruthless, but anyone who's worked in an emergency medical system will tell you that you have to concentrate your attention on those whose lives you can save and not on those who are going to die anyway, regardless of what assistance you can give. Having got that out of the way, clearly the priorities are going to be, firstly, in relation to nutrition of mothers and children, and in terms of trying to therefore deal with the infectious and other complications of undernutrition. Then, of course, the burden of chronic diseases that is there, I think is there with us. In any modern society, anywhere in the world, rich or poor countries, has to be tackled. All those diabetics, all those people with cardiac disease, even some people with cancers. So maternal and child health and dealing with non-communicable disease is going to be important. The other dimension, I think, is going to have to be to deal with the victims of trauma who might have been stabilized, but who will destabilize unless they get definitive treatment for their trauma, be they war wounded or other forms of trauma. And then, of course, the legacy of the sexual violence that is there, which we know is not just a few cases here and there, but there is a pandemic of sexual violence, an epidemic of sexual violence that has been prevalent in Tigray. And the direct and indirect consequences of that are a full-scale emergency in their own right, if you like. So all of those are going to be simultaneous priorities. And then, of course, you see, with limited resources, then one will have to design the ways of providing assistance. So we don't want everyone to be rushing to hospitals, which are on their last legs anyway, as you've just heard. And so the system for emergency healthcare delivery, if access is available over the whole territory, is going to be quite important. How to go to where people are needed, rather than to force people who are desperate to come to you. So investing in the organization of delivery of that care in the extraordinary settings that we are talking about is going to test the organizational capacities and the most brilliant minds that Tigray can deploy in its early recovery phase.
Thank you, Dr. Kapila. Oh, thank you for guiding us on how to prioritize critical health issues, to plan a systemic delivery, as you mentioned it, and to base on evidence-based. Thank you for this insight.
Thank you. Thank you, Dr. Kapila. For this second half of the panel discussion, we're going to focus a little bit more on looking ahead and thinking about the important considerations and steps to be taken to facilitate an emergency response, but also rebuild the healthcare system that we know has collapsed. So my question is directed to Dr. Hayelom, and along the lines, as Dr. Kapila mentioned, regarding the epidemic of sexual and gender-based violence in Tigray. We know that you have been involved in documenting and reporting the widespread use of rape as a weapon of war and the physical and psychosocial impacts on the shockingly large number of survivors of sexual and gender-based violence in Tigray. We are yet to fully grasp the full scale of sexual and gender-based violence and the burden of mental health illnesses at a population level. This certainly underscores the need for improved access to high-quality, multidisciplinary, and culturally competent mental health services in Tigray. No doubt this will be a massive undertaking, particularly when we think about the poor mental health delivery capacity in Tigray and the poor uptake of mental health services for various reasons in Tigray, Ethiopia, and other similar countries. Nonetheless, this is an important priority and also responsibility for us as healthcare professionals to intervene in this realm. My question for you, Dr. Hayelom, is if you could share with us the medical and psychosocial care that is being provided to the survivors of sexual and gender-based violence in Tigray. In your response, if you could highlight what the capacity of mental health services in Tigray looks like, what are some of the unmet needs that remain, and what you think should be done to improve the delivery of mental health services when we think about the post-war period.
Thank you, Asif. Yeah, as I did mention before, and also my colleagues mentioned, Professor Tony and Dr. Kapila, what was happened in Tigray, especially in girls and women, was an extreme brutal. It's an extreme brutal that I tried to look on the history of some of the mentioned Dr. Kapila about the former Yugoslavia. The brutality, sexual brutality was more or less equal or a little bit even higher in Tigray because there was an insertion of foreign materials to the girls and women bodies, which is I didn't see in the rest part. So it's the extreme brutality is beyond comprehension to mention here. And what was happened in early times, in November, when the federal government took, and we started to saw on this in early December, we started to saw a flood of girls and women complaining of sexual assault and also sexual injury coming to the hospital. So there was, before that, we had a very one center, which is one-stop center, which was established along with the regional government for very rare cases to see any forensic evidences was established in Ayder. So after, when the war broke out and when we start to get quite a number of girls and women, this center was flooded and was in the first of shocked. And then we asked initially, what we did was we have to report to the university. And the university management has took an initiative led by Professor Fatin, take up an initiative to at least provide some sort of early hygienic materials. And because most of the girls and women are coming, they have been HIV positive, hepatitis positive, and some of them have also pregnancy. So this, we need a resource. And then the resource that first we get was from the university, because it's a university hospital. And the university management was really quite very helpful. And then we try to help in a way that we have, because everything was shut down and there was a complete incommunicado in early times of December. And then the number increased. And then we also take to these girls and women who are at least a little bit better to the safe house in downtown. And those who need a gynecological care, we just admitted them to the hospital. And as I said, the hospital was on early December was in a very difficult situation because there was no electricity and there was no any supply. And then our machines like CT scan, MRI, and ultrasounds are non-functional because of the power and spare part. So we couldn't help them much, but they have been admitted and our physicians are looking to take care of that. And those who need also abortion, it will also have been conducted. But the problem is those who have an HIV positive and hepatitis positive. So until March and May, Ayder alone has received more than 550 serious cases of rape. And the rape was so systematic that it damages the psychological and the mental well-being of the women and girls. Some of them have developed a full-blown psychiatric problem. Some of them, they need a family to take care of them. It's not only a sexual assault and abuse, they have also mentally lows and they need people. So we cannot take them to the safe house. because they need a special care. And then we admitted them to the psychiatric center ward that we have. And the problem again here is in manpower. As I said, Ayder has few psychiatrists, not more than 3, and only 2 clinical psychologists. And the whole Tigray has no any psychiatrists out of these 2 and 3. So if you see before the war even, the psychological and the mental and the psychiatric problem, which has been, of course, a widespread, has not been given attention. And then the human power was very less. Then after war and after this all blown out cases coming out, and then you can imagine that will be catastrophe. So we try to manage these few patients, but the number is increasing. And some of them have really very difficult because, for instance, one case, a 69-year-old nun have been raped and came to our safe house. And Ayder has been occupied by the military and it was guarded by the military. Thinking of that, the TPLF fighter may come at night and get treatment so that they really scrutinize for every individual who are coming to Ayder. So when this nun came to the gate of Ayder and she saw a military, and then she abruptly collapsed because she said, those have been raped me. And again, I came to hospital where I can get treatment, but I find the military again. So now you can evaluate how the mental has been tortured and the psychological has been going on. So the hospital has tried. And also the safe house, this was before the blockade. But after a complete blockade, after June, the safe house and the center has been collapsed. Those girls and women who need attention, who are really afraid of to go to the community to intermingle and to continue their life, has been left at limbo because there is no service, there is no psychological improvement, and there is no psychiatric treatment, and the service is not providing every material they need, so they just left out. So what I'm thinking is, if the blockage is open, so we need a very critical mass of psychiatry and clinical psychologists because we have a social trauma in Tigray. And then this can give a training for those who have been underground already, or they can also try to at least help and provide these psychiatric problems to those who have been affected by sexual violence and also to the largest extent by the war itself. And another example, I will not mention the village. One village in central Tigray is an example of these horrible sexual violences. The whole village girls and women who have been there have been raped. And now it is time that they are giving child. And then the problem is now they have been started to divorce with their husband because they have been raped, and then they have a child from outside of their marriage. So the whole village is in a social crisis. So what would happen in Tigray is so systematic and by itself can be graded to as one of the most brutal genocide the world has been witnessing in this 21st century. Thank you very much, Asif.
Dr. Hayelom, that was very difficult to hear and comprehend. You spoke about the story of the nun who was sexually raped. It just indicates the brutality of and the systematic nature of sexual and gender-based violence. You also covered that there's limited capacity in regards to health professionals that are trained in mental health and psychiatry to provide care to the huge demand of mental health illnesses. You also underscored that it is not just mental health illnesses when we think about victims or survivors of sexual and gender-based violence, but there is indeed medical needs, as you mentioned, such as sexually transmitted infections, hepatitis, and other bloodborne infections. So that's a very multifaceted problem and not something just the healthcare system in itself can address. I think it requires a big social understanding, consensus and understanding on how to speak about mental health services, how to increase uptake of mental health services, and really find innovative ways to integrate mental health with primary care and just have it be a routine care that we can provide moving forward. And you certainly highlighted the need for mental health professionals outside to really invest on building the capacity and in trying to find innovative ways to integrate it with the primary healthcare system. Thank you so much for sharing that insight, and of course, your role in creating awareness and reporting on this important issue. Thank you.
I have a question for Professor Tony. Professor Tony, you have spent several years in Tigray. You have actually shared with us your firsthand experience, as you spoke like a few minutes ago. You have established and led health professional training as well as multiple research programs. You have been involved in strategy and policy formulations, and also in building sustaining health workforce for Tigray. Now, looking ahead in the post-war period, Tigray will be facing serious challenges around priority setting and allocation of the limited resources, those meager resources to meet the increasing burden of existing as well as newly emerging health needs. We were just talking about the emerging mental health issues, and then malnutrition, severe malnutrition, on the top of the existing chronic and acute diseases that Tigray has been handling throughout. This is further complicated by the loss of workforce. Like a recent study on the British Medical Journal, they reported about 50% of the health workforce, they are not reporting to their work institutions as of now. So my question is, I know you have just spoke on the status of health professionals and their displacement and the horrible situation they are just going through. You just spoke. You mentioned that Ayder was training specialists, not only for Tigray, but from Tigray, but also from the rest of Ethiopia and outside of Tigray, including Sudan. In that line, just to go to kind of to have the full picture, to hear it from you directly, based on your experience, what is the current state of health professional education and training institutions in Tigray? And current state of Tigray's capacity to train and sustain a new health workforce that can cover the upcoming issues?
Well, I think, first of all, it's important to recognize that since 2020, the Ethiopian government has given no budget to Mekelle University and to the hospital, which is owned by the university, which is supposed to be a federal institution. It's like, to them, it doesn't exist anymore. So there's no salary, there's no budget. So people who are going to work are just volunteering. The problem they have is they have to eat, they have to have transportation, unless they live close to the hospital, and they have to provide for their family. And even going to work, what can they do? There's no supplies, there's no equipment. And I think if I can just to add on to something, fixing the healthcare system needs an infrastructure of the society to function. The average 88% of the population in Tigray lives in a rural area. The patients that come to the clinic, the average person travels more than a day, and they usually spend 100 birr to get to the hospital. That's why there are many of these inns around the hospital, because people have to come in the day before. You have no transportation system, you have no fuel, the people have no money. They can't get to healthcare. Even to get to a healthcare clinic, it's probably an hour or 2 hour walk at best for many of the people, because they live in very remote areas. Even though Tigray isn't that big in terms of size, but it may take you 2 hours to get down a mountain. Okay, so they are very isolated, and there's no communication. There's no cell phone. They can't, even if they had a cell phone, they can't charge it because there's no electricity. So healthcare has to be seen when you have a complete failure of society, no fuel, no transportation, no communication, healthcare can't function. So all of those things have to be restored. And I think now you're seeing, and I talk about once a week to professionals. I have some communication with Tigray, which I can't discuss, but I also talk with people in other parts of Ethiopia. Tigray is the most affected, but it's spread to other parts now because of lack of funding. I mean, the healthcare professionals are just in shock because they don't know when this is going to end. I mean, they're saying, what am I doing? What do I do with my life? Some have taken up defense positions. Some have started to be farmers because they have to feed their families. There's no functioning medical school right now at Ayder. It cannot function. A few people have finished their graduate work, but certainly nobody new can start. We were just starting a PhD program in neurobiology, the first one of the few in Africa, the first one in Ethiopia. It's dead. So it's really hopeless because at this moment, there's just no clear-cut path to the future. And even like what Dr. Kapila said, that once it ends, that's just the end of the beginning, to quote Winston Churchill. It's going to take years to rebuild. We're going to have to talk to NGOs. We're going to have to talk to governments. We don't know. It's going to be very dependent upon whatever governmental structure ends up being there. Who's going to be in charge? Right now, it's a de facto country, but it's got no relationship with anybody. It's receiving no supplies. So I mean, I think at best you're going to have to look at there has to be at least some type of air supplies initially, although that won't be enough.
Thank you, Professor Tony. A collapsive system with no functioning medical school, while expecting rising cases of emerging cases, health needs, showing that this is the humanitarian catastrophe and worst form of public health crisis that the world is seeing behind the siege. So speaking of rebuilding, you mentioned about rebuilding. Professor Kapila said, this will be the unseen, how the situation will be exposed and the mortality will increase. Those are so, but what are some of the important considerations or approach to train and retain and deploy a health workforce that can handle the growing health demand? Following, as such, how can one strike once we get the cessation of hostilities and then open access? And how can one strike a balance between training a workforce that can provide primary health care and a workforce for specialized care? In this regard, what will be the role of stakeholders such as the Tigray Diaspora and the other developmental partners in rebuilding a post-war health workforce. We're just wishing for the best.
Well, I think, first of all, it's going to be much more than Mekelle University, although Mekelle University will take a leading role. There are several other medical schools in the region. Their hospitals have all been absolutely destroyed. And then there's the Tigray Regional Health Bureau. All of those things, apart from Mekelle, which is you're looking at tens of thousands of employees, thousands of clinic sites, transportation and communication. It's going to cost millions of dollars. So there's going to need to be funding for that. There's going to need to be an assessment of what the needs are, a comprehensive assessment, which will require a task force of probably external groups and internal groups working together. You're going to have bring in some expertise in how to rebuild that, which probably is not present in the university at present. You're going to have to try to find people and put them back wherever they've gone to do an assessment. Where are they? You're going to need to create some stable supply lines. Looking at resources of fuel, of trucks, of ambulances, of where the supplies going to come, how are the supplies going to get there. Clearly, you can get some things into Mekelle Airport, but you can't. It's very inefficient. So there's going to have to be some agreement for land-based supplies, either coming through the western route through Sudan, some agreement to come through Djibouti. All of these things are priority. You know, just saying there's peace and you stop the war. If you don't do that, people, you know, hundreds of people are going to continue to die every day. I think the diaspora, there's lots of expertise in the diaspora that could come help, especially because they speak Tigray, which, as you know, most of the people in the countryside do not speak Amharic, they just speak Tigray. And then we talk about the Irobe and the Kunami, which they're not high numbers, but they're significant populations as well. Whenever we used to get an Irobe or a Kunami at Mekelle, we always had to find a nurse who could speak that language. So I think it's going to take large working groups, and some of that planning needs to start now. This is something HPN could start to do now, because there's not enough resources in the Tigray government to deal with it, because they're in survival mode right now.
Thank you, Professor Tony, again for helping us understand the war's devastating impact on education and training of health professionals in Tigray, for shedding light on the importance of Tigray Diaspora and other developmental partners in rebuilding the healthcare workforce. Thank you also for reminding us that planning for the post-war policy should begin now, as Tigray internally is devastated with no access to resources or funding, that to use our privilege, not only to advocate on behalf of our voiceless people, but also to use our skills and expertise in planning and organizing ourselves for the rebuilding process. Thank you.
Thank you. My question is to Dr. Kapila. So in a way, many Tigrayans are forced to become experts of health system strengthening and this field of fragile and conflict-affected settings. Nonetheless, this is where we are, and this is the responsibility that we have. So my question is, you know, when we look at the research on health system strengthening in fragile and conflict-affected settings, we see this intimate link between the process of strengthening the health system with building a nation and a state. Another important theme that we see is particularly around the immediate post-war transitional period, is the importance of government capacity, government ownership, and stewardship of the recovery process. This is crucial to coordinate the influx of donors, NGOs, and other developmental partners to address the dire humanitarian needs while making sure that these interventions are also building towards a sustainable health system. As we think about the current and future socio-political context of Tigray, which we can all agree is very complicated and complex and has a lot of uncertainties, which makes it very difficult to predict. What are some of the important considerations to keep in mind as we think about rebuilding a health system with the framework of a Tigray regional state? Please discuss the steps that need to be taken by the Tigray government and other allied stakeholders, including civic and nonprofit organizations within the Tigray Diaspora, such as HPN4Tigray.
An interesting question. Actually, I'm just overwhelmed with excitement at the thought of even thinking about the future of one day having the problem of trying to reconstruct Tigray. I mean, it'll be a problem worth having, because when the challenge of recovery comes, we'll be all jumping up and down and wanting to be right in there addressing it. Now, in doing so, I think it's very, very important to learn some lessons. I mean, the reality is that Tigray should first learn the lessons of its own weakness. So what happened? It had a huge infrastructure of health centers, hospitals, which was described at the beginning of our discussion. It was making huge progress in terms of its health indicators coming from a low base. And then the whole thing collapsed in a matter of months. So for me, that is a critique of the prevailing system of that time. You know, the system was obviously completely non-resilient, was completely non-sustainable, that it could, in a matter of months, come to its knees so fast. So I am actually a critic of sustainable health system approaches in the traditional sense. And I say this not as a critique of Tigray, but as a critique of what I've observed when I was in West Africa. I saw, the Ebola bring the health systems of the 3 countries of West Africa crashing to the ground within a matter of weeks. We've been seeing the last 6 months what's happened in Afghanistan, despite all the work done in health assistance over the past decade or more. And you only have to look around the world in relation to COVID to realize that even in rich countries, this virus has brought the system to its knees. So I think Tigray's problems allow its people and its leaders to rethink the paradigm of what is meant by sustainable health recovery or health, including health systems. And this is a crisis wasted if all that you do is to go back to the status quo ante. Because peace in Ethiopia, including Tigray, or Tigray outside Ethiopia, that remains to be seen, will remain fragile. Because we know from history, and you only have to look at neighboring Sudan, that once a country has tasted the special drug of violence, it's going to remain prone to that violence for a very long time to come. At least in your lifetime, you will see further cycles of violence because you're younger than me. Now, my point here about saying is, please do not go back to the old Tigrayan health system, because next time the violence happens, it'll crash to the ground like it did in this time. Try and develop a new paradigm of resilience, which means that it will not crumble to the ground again. And by the way, this approach also applies to food systems, education systems, and health systems. So the problem with health systems is, as taught by international organizations, is that it's a hierarchy. You have the great big hospital on top. Then you have secondary hospitals. Then you have health centers. Then you have clinics. Then you have a primary care health network. And no country in the world now can afford such an elaborate hierarchical structure of healthcare. And nowhere in the world are people behaving in the healthcare behavior. Nobody says, okay, right, now I'm going to go to my doctor. Then I'm going to go to my hospital, etc. In these days of internet, in these days of simultaneous access to many resources, capacities, and knowledge, people seek their healthcare in the easiest possible way, wherever they are. So my challenge to my friends, my professional friends in Tigray, and all those who care about Tigray is, let us make a completely different approach, where the health system of Tigray is reliant on the empowerment of the people of Tigray. And that means much more use of self-care, much more use of knowledge and technologies, which of course will have to be reconstructed, I know that, etc. But also, I think less reliance on unitary experts. You know, if you only have one kidney transplant surgeon or one lung cancer specialist or something, don't be surprised, you know, if the whole thing comes down on this poor person's back, if that is a system you've built up. I don't know, you know, I can't give you this, we would need a whole conference on this. And I think what HPN should do is organize a day's seminar on actually envisioning a completely brave new world that is not only ensuring that no matter what happens to Tigray, its health system will not crumble in the future. No matter what happens, no matter how many drones come at it, no matter how many future genocidal wars are inflicted on it. That's number one, how to design. Number two is, can you imagine, can you think about what the word sustainable means in this context? And if you look deeper into this, we may in fact invent a new paradigm of healthcare for the 21st century that might also be an example to the rest of Ethiopia, to the wider Africa, where there are many, many other situations, not comparable, but not as bad, but bad enough. And of course, in other continents around the world. So I answer your question by giving you a challenge that we have to think differently. Restoration is not the answer, because restoration will only mean going back to the past, which is a very bad use of this particular crisis. We have to move forward, and that means transformation. And it doesn't mean reviving the old institutions. Building on them, yes. Building on human capacities that are doing a great job now or have done in the past, yes. But going back to the old network of institutions that Tigray had, in my opinion, is not the way forward. I know what I'm saying is quite controversial, and I hope that it will arouse some debate, but it's very important for the sustainable future of Tigray.
Thank you, Dr. Kapila. These are the live discussions that we have within our health policy team, and I think we are aligned with what you've mentioned regarding one, when we think about sustainability, we're also thinking about resiliency as well, and perhaps we're using this crisis as an opportunity to reassess, reevaluate the healthcare system of Tigray before the war. And like you mentioned, trying to identify what are the assets that we can protect and build upon, and also how can we integrate new technologies, new innovative ways, and perhaps build the paradigm, as you mentioned, in delivering healthcare after a time of crisis and conflict. And we are actually motivated, and that's, I think, what aligns the mission behind HPN and specifically the health policy team. So I think, as you mentioned, we're going to have more discussions around this, and I hope that you can be part of those discussions moving forward. And before I pass out, this is something that requires many Tigrayans to be involved as active stakeholders, and not really leave it up to NGOs and whatever this global health scholarly community has built. I think this is a challenge that Tigrayans have the opportunity to really contribute, because they have the unique context of what's happening. So thank you, Dr. Kapila.
Thank you, Dr. Kapila, again, for advising us, giving us the kind of how to rebuild the system in forms of resilience, transforming it by transformation, not only by restoration, to focus on Tigray tailored health system that can serve the needs of the consumers, not merely restoration, but transforming it based on the need of the population, on the age, on the factors associated to Tigray. Thank you. Yes, thank you. As Asar said, we need to continue this discussion with consultation with you as in the coming months and years, of course. My next question is inspired by what President Jimmy Carter wrote in a foreword for a book. He writes, public health workers led the fight to eradicate smallpox. They are now working to eliminate other diseases. We should all strive for a time when, through the efforts of public health workers and others, war too will be eliminated. End quote. So my question is, Dr. Hayelom, I will start with you. Before leaving Tigray, you have mentioned it. I heard you saying today, and I know how strong advocate you are based on your first-hand information, what has happened in Tigray when you were there. So before leaving Tigray, you and other professionals, your colleagues, tried to expose what was taking place in Tigray, including the sexual gender-based violence, the deliberate destruction of health systems, blocking survivors from accessing care at Ayder. And you and your colleagues tried to expose all of this to the outside world too. What do you think were the roles and responsibilities of local governmental institutions, such as the Minister of Health, Minister of Women and Children Affairs, and other local actors? What were the missed opportunities to avert this humanitarian catastrophe in Tigray?
This is a really very difficult in any way to say, because it depends on what was in their mind when they come to Tigray.
Dr. Hayelom, excuse me, can you speak a little bit closer to your camera?
Okay. In any way, I will try to mention the missed opportunity that, in early times, as a college management and also as a university management, we try to engage all stakeholders, especially the conflict actors and also the civilians who have been administrator of the region in that time. So in that way, we manage to get at least the military headship, and also the civilian headship, and also the ministries in Addis, with the university management, with the Professor Feten and me and others, has engaged several times with the Minister of Health and Minister of Women and Youth Affairs and others. So yeah, initially they were in denial. They didn't listen us. They said, you are fabricating stories. You are coming up with the data that was not on the ground. So nobody was to believe what was happening until we brought the ministers, officials, and also the president of the country to a place where the girls and women have been traumatized, sexually abused. And then afterwards, they try to a little bit understand the problem, but still they denied the magnitude of the sexual violence and also other trauma of the civilians are sustained in Tigray. So the message, in my view, it was calculated. They just came to subjugate the society in a multifaceted way. In sexual violence, and in air and also bombardment and other trauma. But at the end, what we can say, or what I can say, is that this all gravity of the magnitude of this atrocity in Tigray could have been avoided if they could have listened us the problem, especially in women and girls in your time. They could have been accepted it and also admitted it. And then they could have been taken an action of remedy for the sexual survivors. If they could have been all the three, at least the magnitude has been reduced, or could have been reduced, and those who have been already affected can have get rehabilitated and they can have been integrated to the society. But all this have been denied. They denied medicine and they denied us also understanding of the problem, and they denied us also listening what was happening in Tigray. So all this end up with a mass or with a large scale of abuses in every aspect of life of individuals in Tigray. So they could have been listened and also admitted, because the admission is also at least the first initial for remedy, and they could have been taken also an appropriate action, or justice could have been served for those who have perpetrated all this calamity of problems in girls and women particularly. But all this have been avoided or sidelined, and so that this has been continuing till they left the Tigray region in June. So this, I think, could have been a very good opportunity that they could have been engaged us and engaged the Tigrayan community and then listen and taken an action on that time. But all this was missed and things had been become havoc in the last 8 or 6 months.
Yeah. Thank you, Dr. Hayelom. One point is, regardless of their response, as President Carter is expecting of us, you spoke and you fought on behalf of the victims. And it's unfortunate to imagine, that we and these health professionals that were ignoring you, or the officials that were ignoring you, actually, it doesn't even look like, it looks meaningless that we sat in similar classes and we took similar oaths to save lives, civilians along with, as well as prisoners of war, regardless of politics. But thank you very much for what you have done for the people of Tigray, and thank you for sharing your experience today.
Thank you. My question is to Professor Tony, and I want to also give you a chance to reflect on the remarks made in the prior questions. I see that you have your hands raised, but also along the lines of what Dr. Hayelom answered. What were the missed opportunities by the local actors, the local governments, non-governmental institutions, and academic institutions? What is the role, or what should be the role of local actors, but also the larger global health scholarly community in advocating for the respect of human rights and promoting peace?
Well, there's a very difficult situation now that actually started even 1 or 2 years before the war started. And Dr. Hayelom was a part of our research. We got international recognition for this neurotubular defects, and the WHO noted it. And then there was a national conference put on, which I went to, and the federal government at that time said they didn't want to hear about it, that babies had poor nutrition in Ethiopia and were having problems. And this started a pattern which goes on now, where the problem that international organizations have now is if they say anything about Tigray, they'll be cut out of the country. So I'm acting as an interlocutor for many organizations now, because and they won't talk to us because they have to make a decision. If they don't mention Tigray, they can help Afar, they can help Amhara, they can help. But as soon as they mention Tigray, they'll be accused of being collaborators. So that's one major problem. So nobody will offer any help. And like I said, this has actually been going on well before the war even started. And I think that's the first. There has to be some international pressure to allow these unbiased international organizations to help Tigray. I mean, that has to come from the Western democracies and the UN. We cannot get anywhere unless that happens. And I will say, and the other thing I wanted to add on, I mean, the Minister of Health trained at Ayder. And now she pretends like it doesn't exist. You know, and Dr. Fetian and Dr. Hayelom have been way on the limb, even risking arrest, trying to push her and others to help Tigray. And they really deserve a lot of credit for that. But there has to be some international pressure. And I will say this, I will say the one thing that I think has changed recently is that for a while, the news that was coming out of Tigray was just about the war. And I think now the news coming out about what the suffering has been important, because the world is starting to see, especially in the past month, the world is starting to accept the suffering. You know, and I think that was not enough before. And I think the world is finally going to get it. And I just hope and pray that people will realize how severe this is.
Thank you, Professor. Thank you. I don't have much more to add instead of what you said.
Thank you, Professor Tony. Dr. Kapila, just to close things off, I have the final question for Dr. Kapila to you. What are the duties of public health professionals such as the World Health Organization, UN agencies, as well as civic society organizations in being bridges for peace and ending humanitarian crisis, to avert wars, to avert another Tigray, Yemen, Syria? Thank you.
What an easy question to end our discussion.
Yeah.
What an easy question to end our discussion. Well, I think if you were to ask what was the role of these agencies such as WHO, UN, and other international organizations, I would have said that over the decades since Second World War, that role has been an honorable one, a necessary one, and by and large, a beneficial one. Because under the most difficult circumstances, they have kept humanity alive, kept connectivity going between warring peoples, and sought to find peaceful dispute resolutions. But that world is finished. Now, into this decade of this century, we find a situation where there is a trade-off to be made between assistance and voice, and giving voice to the inequities that are taking place out there. And any organization, whether it's a UN agency or any other, if they give voice to the voiceless or speak up for the terrible things that are happening anywhere, then they tend to lose access to help. So this then poses a dilemma for those organizations. And it's a position that every organization has to navigate in its own particular way. Now, the question really is, what do the global public in today's world expect these organizations to do? And my feeling is, and this is only, I think, a feeling, but it's based on some kind of experience-based intuition, is that while there are many, many organizations that can provide help, only those who have the highest of moral voices and have the courage to speak up can actually progress the path towards justice and peace. What that means is that I regret that too many organizations of the UN system are self-censoring themselves. They're afraid to speak up. Their leaders are more and more cowardly in not standing up to the inequities and the horrible injustices that are taking place. And partly that is because of the control of purse strings. Partly it's because of the power of patronage and other things that are going on. And then, of course, we have a paralyzed United Nations system anyway, because of the paralysis within the Security Council and the growth of the illiberal order led principally by China. What that means is, and this is the summary answer to your question, it is better not to expect anything from these agencies. And as the Ethiopian example has shown, every time any agency raised its voice, it got thrown out and attacked. And a record number of aid workers have been killed in Tigray since this conflict started. So the best is that in the current geopolitical environment, we can continue to aspire towards a global order and a good role for these organizations, which are people by very good people and courageous people. But the way the global order is constructed, they're not going to be the salvation of situations like the one we see in Ethiopia today. And the more we realize that realpolitik, the more I think we will have a more realistic chance of taking the destinies, that people can take charge of their own destinies and create their own order. And the problem is not helped in that we have a hierarchy of the United Nations and the African Union. So the UN will not act if the African Union will not act, because we're in the days of post-colonialism, and where every time you say anything critical of an African leader, the critic is accused of being a neo-colonialist and or a colonialist, and all that type of thing. And this whole Pan-African movement has become a hegemony for the tyranny of African leaders, turning tyrants of their own populations. And the UN cannot act. International organizations cannot act. And we see this not just in Africa, we see this in other continents. In Asia, we have similar problems. A long answer to the way of saying is that as things stand at the moment, I can't answer your questions. There is no bridge for peace from these organizations. When the Secretary General of the United Nations, if you like, stays silent for months on end when the worst of the ethnic cleansing was taking place. And as soon as the worst of the ethnic cleansing had happened, and he himself had been re-elected, then he's happily mouthing platitudes. And even as the drones are attacking camps in Tigray, he's commending the Prime Minister of Ethiopia for releasing a few symbolic political prisoners. Under those circumstances, we cannot, I think, have any belief in such organizations. We must distinguish the political part of the UN and the technical part of the UN, of course. The World Food Programme, the World Health Organization, UNICEF, the Office for the Coordination of Humanitarian Affairs. All these are good people, good organizations trying to do good things in their sectors, in their areas of intervention. But because the political act has now infiltrated the humanitarian act and the other way around, the health act and the humanitarian act, it means that the bridge for peace has broken in the middle. So whether you approach it from the side of conflict resolution and politics, or you approach it from the side of assistance and humanity, you fall in the middle. And that's a current tragedy. So in the same way that I said that the challenge for Tigray is not to go back to the past, but to transform itself, the challenge to all of us and the Tigray's legacy for the wider world, if you like, is that transformation of that international order and the way we connect humanity and political tasks of conflict resolution and peace building. It's a job we only just started on.
Thank you, Dr. Kapila. We all need to hear this directly from you. Thank you very much. To conclude this event, I would like to thank all our panelists, Dr. Murkesh Kapila, Dr. Hayelom Kebede, Professor Tony Magana. Thank you for sharing your expertise and its applicability to the health and humanitarian crisis happening in Tigray. Your insightful comments and action items will help us forge a path forward towards rehabilitating Tigray. Thank you. Thank you.
Thank you very much. Thank you.
Thank you so much, Dr. Wayne, and our audiences. In all accounts, it is quite tragic what is taking place in Tigray. And it is indeed a shame to humanity as well as scientific advancement. Thank you to our speakers for being so generous with your time and expertise in joining us today. Our audiences, thank you so much for making the time to engage in such an important humanitarian matter unfolding in our lifetime. I want to say a few words.
Thank you very much, Dr. Rishad.
Imagine countless children dying because they are denied the most basic things to sustain life, food and medicine. A mother seeing her baby perish as she is forced to starve. Hundreds of civilians being bombarded with airstrikes and drones where there is no access to healthcare. Tigray can no longer wait. And it is time for the international community to use everything at its disposal to push for unfettered humanitarian access to Tigray. You heard it from our experts today. We all have a duty to stand with humanity. We call on all of you here today to call on the international community to end the suffering and save lives. Those of you in our audiences, please take 1 minute to copy and paste the tweet in your chat. And those of you who are following along from home, please tweet what you see on your screen and help us advocate for humanitarian access to Tigray so that much needed food and life-saving medicines can be delivered. As mentioned earlier, please continue to engage with us. This panel will be followed by serious advocacy campaigns and including a very important event coming up this Wednesday on the 14th of January. There will be a national protest in the Washington DMV area. Please stand with solidarity with those suffering and show your support. If you are a healthcare worker, please wear your scrubs or your white coat, and please, 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 let's get our voices heard. Let's demand for access to Tigray. Regardless of politics, humans are dying, humans are starving, humans are going through unimaginable suffering, and it is time to end this catastrophe. Thank you so much for everyone for your attention and your participation. Thank you so much for your sharing your time with us this Saturday afternoon. Thank you.